Okay, imagine this. You've got a country pouring tons of resources into HIV awareness. Everybody knows the virus exists. But for some reason, infection rates among young people are still climbing. This was the massive puzzle facing Nigeria. And the answer, as it turns out, had nothing to do with general awareness. It was all about a hidden crisis of real knowledge. So, to really get a sense of the scale here, just look at this number, 3.4 million. Let that sink in for a second. That's how many people in Nigeria were living with HIV when this study was done. That's the second highest number in the entire world. It's a staggering figure, and it's the backdrop for the whole paradox we're about to dive into. And this is the big question that had researchers just scratching their heads. I mean, with all the campaigns, all the general awareness, you'd think the infection rates would be going down, right? But no. Among young people, we're talking about 15 to 24-year-olds, the numbers were actually going up. It just didn't add up. It became super clear that just knowing that HIV exists wasn't cutting it.
All right, so to really get to the bottom of this, researchers realized they needed a totally new way to measure things. They had to move beyond just awareness. They started looking at something much, much deeper, what they called comprehensive knowledge. And this was the real key. It's what separates the people who can actually protect themselves from those who are just left vulnerable.
So, what is this comprehensive knowledge anyway? Well, it's not just about knowing a fact or two. Nope, the researchers set a really high bar here. It was basically a two-part test. First, you had to know the real, scientifically proven ways to prevent sexual transmission. But, and this is just as important, you also had to be able to reject the most common and dangerous local myths about how HIV spreads. You had to get both parts right to be counted. Let's actually break down what that test looked like. To be counted as having comprehensive knowledge, a young person had to get all 5 of these points right. First, know that consistent condom use works. Second, know that limiting yourself to one faithful partner is a prevention method. Third, and this one's crucial, understand that a perfectly healthy-looking person can have HIV. And then, you had to reject 2 really pervasive myths, that you can get HIV from mosquito bites and that it's spread by supernatural means. It's a tough standard for sure, but a totally necessary one.
Okay, so armed with this new, much stricter definition, researchers dug into a whole decade of data. They wanted to see if this critical kind of knowledge was actually on the rise, and what they found? Well, it's a story of progress, yeah, but a progress that was dangerously, seriously uneven. Let's get into the numbers.
So the data they used came from 3 huge national surveys. This gave them a really clear 10-year window to work with, looking at the years 2003, 2008, and finally 2013, to see exactly how things were changing over time. Now, at first glance, their results actually looked pretty good. The percentage of young people who had this comprehensive knowledge nearly doubled in 10 years. It went from about 15% all the way up to 27%. That sounds like progress, doesn't it? But that is only half the story. Because here's where the perspective totally shifts. When you take that 27% and you put it up against the global target, the picture changes completely. See, the goal set by international health bodies was 95%. 95. So Nigeria wasn't just a little short of the target, it was facing this colossal, gaping chasm. After a whole decade of effort, less than a third of its young people had the knowledge they needed to stay safe. And this is where the investigation gets really interesting. Because the data didn't just give them a simple national average. No, it allowed the researchers to peel back the layers and see exactly who was being left behind. That low overall number was actually hiding some deep, deep inequalities in who was getting this life-saving information and who wasn't. So the first big dividing line, and honestly, it's maybe the most alarming one, was gender. It turns out young men were consistently more likely to have this comprehensive knowledge than young women. Now just think about that for a second. The very group that is often most at risk, both biologically and socially, was the least likely to have the info they needed to protect themselves. That's a huge problem. The next divide was all about geography. It was a classic urban-rural split. If you lived in a city, you were way more likely to have comprehensive knowledge than if you lived out in a rural area. And this points directly to the obvious, right? Disparities in access to schools, to health clinics, to media campaigns, all the main ways this kind of information gets out.
And then there's education. This was one of the most powerful predictors of all. The more schooling a young person had, the higher the chance they had comprehensive knowledge.
And what this does is reveal a massive flaw in the strategy, doesn't it? All those school-based programs were completely missing the huge numbers of young people who weren't even in school to begin with.
And finally, no surprise here, wealth played a major role. Young people from richer households consistently had higher levels of knowledge. And it just goes to show you, in this context, money isn't just about being wealthy. It's about access. Access to schools, access to clinics, and ultimately access to information that can literally save your life. So what does all this add up to? Well, identifying these dividing lines, gender, location, education, wealth, it's not just some academic exercise. This is the most critical finding from the entire study, because what it gives us is a roadmap for action. It tells us exactly where we need to aim our efforts.
You know, the study's own conclusion really just says it all. Basically, high levels of awareness have not translated into the comprehensive knowledge necessary for HIV prevention. Let me put that another way. Getting people to be aware of HIV is the easy part, but getting them the deep, practical, myth-busting knowledge, that's the hard part, and it's the only thing that actually works. Nigeria was acing the easy part and failing the hard part.
So who are the people that need to be reached? The data gives us a crystal clear list. We're talking about young women, rural youth, young people with no formal education, especially those out of school, and youth from poorer households. This is all the proof you need that a one-size-fits-all campaign is just doomed to fail. To make any kind of real difference, the approach has to be super targeted. And that really brings us to the single most important takeaway from all of this. Generic awareness campaigns, they're not the answer. To actually turn the tide against HIV, the efforts have to be absolutely laser-focused. They have to be designed from the ground up to reach these specific people who've been consistently and systematically left behind. And all this leaves us with one final, and I think really vital question. When information can literally be a lifeline, the difference between life and death, can we really afford for it to be a privilege? A privilege for the educated or the wealthy, or for people who live in cities? This research doesn't just give us data, it throws down a moral challenge to health organizations, to governments, to all of us, really.